Hi there, I am Nikki Cameron, a holistic trauma relief therapist and founder of Emergent Counseling Consulting. And I would like to share with you a three-part series of things to consider before starting therapy. If you're already in therapy, these are also things that you definitely can take into consideration. But I would like to share these things. And so my first four tips are: one, prior to going to therapy, I strongly encourage that you seek medical attention. Oftentimes, when someone walks into our office and they are presenting with, for instance, severe depression, we often encourage them to go and see a primary care doctor to get their blood work done, get their inflammation markers checked, because some medical conditions actually mimic mental health disorders. For instance, thyroid issues. Individuals with thyroid issues, severe dysregulation or disruption in their hormones, may be experiencing thyroid issues, and that presents oftentimes like major depression. So I strongly encourage that you consider seeing a medical provider and requesting that your hormones be checked, your inflammation markers be checked. Also ask for your iron levels to be checked. Number two, research your therapist. Check out reviews that you see on Google, even though sometimes some of them may not necessarily be accurate, but you typically will see a pattern, right? So if you see a pattern of consistent, favorable reviews for the therapist, that's something to consider. But also research your therapist to see what methods they use in treatment. Are they evidence-based? What outcomes do they have with these treatment methods that might be used? I encourage you to interview your therapist. Notice how your system is feeling in that individual's presence to see if the energies feel like they align. They may not feel that way on the first visit, but it is important that you interview your therapist to see if it feels like a good fit for you. And this interview process should really take time. You're constantly learning each other to see if it's a good fit. Number three, ask for help. Oftentimes when someone reaches out for therapy, there's tons of paperwork that needs to be completed, especially if you're utilizing insurance, because the insurance companies, they have restrictions and there are laws that we have to adhere to as treatment providers. So unfortunately, there's sometimes no way around it. However, it is okay for you to ask for support to get the paperwork done. A lot of times the questions that are being asked can be very triggering and overwhelming. Ask, can you come into the office and do it with the therapist? But please, please, please understand that it is okay for you to ask for help. And lastly, impatience is your enemy. Impatience is progress's poison. So I would encourage you to understand that if you are coming in with months or years of accumulated toxic stress, it is not something that can be fixed overnight. So I strongly encourage you to trust the process, be patient, process your impatience with the therapist, set expectations with each other as to what can be realistically expected. But again, impatience can be a major hindrance to your progress. I hope that these tips I share would be helpful for you, and I invite you to join me for future tips, parts 2 and 3. Again, I am Nikki Cameron, a holistic trauma recovery therapist with Emergent Counseling and Consulting. Please take care until next time.